to share his insights on harnessing tech and AI to improve health around the world. Please welcome Dr. David Rhew.
Hi, everyone. My name is David Rhew, and I'm the Global Chief Medical Officer for Microsoft. By way of background, I'm an infectious disease doc who took care of patients during the AIDS era. And during that time, I saw firsthand the dramatic impact that the virus could have on society, and also the vital importance that collaboration and coordination of care plays in battling disease. Today, we're faced with another deadly virus, SARS-CoV-2, and this virus has spread across the globe and impacted so many lives. When the virus first hit Kirkland, Washington, which is not too far away from Seattle, we saw firsthand that hospitals and health systems were unable to handle the deluge of calls and visits to the ERs and the clinics. And working in collaboration with our partner, Providence Health System, we customized a COVID-19 health bot to answer questions and streamline the triage. And anecdotally, we saw a 30 to 40% reduction in the call volumes and reduced foot traffic to the emergency departments. Since then, the bot has been deployed throughout the US and globally. And to date, the COVID health bot has delivered over 1 billion messages. Today, however, the COVID has progressed and we see new challenges every day continuing to emerge. And in response, Microsoft has leaned in to provide support across 4 major pillars. The first is testing, working in collaboration with partners to provide inexpensive, convenient COVID testing. We've enabled safer return to work, school, and allowing us to be able to better understand where the disease is and the variants that are present in the different communities. We're also working across the globe and providing support to organizations to help in their ability to boost the disease tracking and the emergency response capabilities. Specifically, I'd like to call out the work that we're doing with regard to the Africa pathogen genomics initiative. In terms of R&D or research and development, we've been accelerating the pace in which AI can be applied to improve diagnostics and therapeutics. A real good example is the work that we've done with adaptive biotechnology to launch the T-Detect COVID test, which, by the way, received emergency use authorization from the FDA to confirm recent or prior COVID infections. Vaccinations has been a big part of our effort as well. And as you can imagine, it's about delivering vaccines to as many individuals as quickly as possible, but it's also about ensuring an equitable distribution of the vaccines so that high-risk, vulnerable individuals aren't left behind. And as we think about the next stage about returning to work, school, and travel, one example of how we're starting to realize that this can be deployed is managing it through community health hubs. Some of the work that we've been doing with the Los Angeles Unified School District, for instance, in terms of doing testing and vaccinations and enabling kids and faculty to return to school has allowed us to be able to understand the critical role that communities can play in helping battle the pandemic. But one of the things that we've seen throughout the pandemic is the importance of healthcare workers. And unfortunately, healthcare workers are in trouble. Recent studies have shown that about 50% of physicians and nurses are burned out. And a large part of this has occurred even before COVID started. And a contributor to that is the documentation requirements, the administrative burdens that we require clinicians to do to document into EHRs. Working in collaboration with one of our partners, Nuance Technologies, we developed and launched a technology that can address this. And the technology is called Dragon Ambient Experience. And what it essentially does is it converts voice to text. It then structures it into a progress note or a history and physical, and then integrates this into the electronic health record. I'd like to show a quick video to give you an idea of what this looks like and the impact it's having.
As a patient, you notice that your physician is typing and talking and, yeah, okay, yeah.
Before, in a typical week, I would probably spend 6 to 8 hours documenting, just simply dictating and signing notes. I bet that my time has been cut into half, if not thirds, because of Nuance now.
The same technology is now available as part of a telehealth visit, which leads us to one of the biggest transformations that we have seen during the pandemic, which is the rise of telehealth and virtual care. Studies have shown a 200-fold increase in virtual and telehealth visits during the pandemic. And while much of the focus has been on video visits between a patient and a clinician, there is one example that highlights an untapped opportunity to transform medical education, training, and accessibility of healthcare globally. Let's run this video to see what this looks like.
I'm not just looking at the pictures. I can interact with those images in that video. What was your plan in terms of incisions?
So my initial plan was to make an elliptical incision.
Sometimes it's actually helpful to do a circular incision. I'm just going to trace out for you what I'm thinking.
It was so clear now how I would have approached it would not have offered me the advantage.
In healthcare, we rely on the see one, do one, teach one model of medical training. This is unfortunately not scalable. With the HoloLens 2, with the Dynamics 365 remote assist, we now have an ability to extend skill training and mentorship virtually, which democratizes healthcare for all. In closing, I'd like to share 3 final thoughts regarding the pandemic. And the first involves public health. Now is the time for governments to invest in public health infrastructure at both the local and the global level. The data need to be interoperable. It needs to be shared in a protected and transparent manner and made more predictive through artificial intelligence. Second is around healthcare. Hospitals and healthcare workers are battling the virus and saving lives. We need to do more to ensure that hospitals and clinicians do not get overwhelmed and overloaded. Now, technology can help, but a large part of this is community-wide adherence to public health measures. And the last is about people. The pandemic has shown us how closely interconnected we all are. Today, we live in a divided world, but the virus doesn't care. Infections can travel from one group to the other, from one region to the other. There are no boundaries. To address this, we need to embrace collaboration, respect, and inclusion. Collaboration to expand our capabilities, to accelerate the progress we're making. Respect for public health measures and the science that underlies those recommendations and the suffering that people have had to endure, not only clinically, but also economically and emotionally. And lastly, inclusion, to ensure that with all of the progress that we are continuing to make, that we do not leave behind the most vulnerable and high-risk individuals. Thank you very much.